Thank you for coming, Senator. My name is Jim Riley. I'm one of the trauma surgeons here. And you mentioned earlier the need to make objective decisions with respect to health care. And so
funding for research, especially.
Research or even policy making.
Yes, sir.
My question is really about objectivity, and every time I see a debate on healthcare, I really wonder whether or not the statistics and the data that people are discussing are accurate, reliable, and it's pretty easy to put something on the table and have somebody else take it off as a statistic that will refute any other statistic. And so are you satisfied with the information that you're getting in terms of its ability to allow competent decision making?
I think on the major statistics, I am. And here's the most disturbing fact of all, and I don't think it's disputed. 47 million Americans are without health insurance today. Half of them will probably, it's because they're out of a job and they will gain employment and then they will then be able to obtain health insurance. And that's nice to know. But the other half, which 8 million are children, then they, and many of those children, of course, it's just because we haven't been around to sign them up. But then you get down into what you and I all know is with a big looming fiscal problem and challenge, and that is those with chronic diseases or pre-existing condition. And that's the area where we really need to address, because the insurers won't insure them. They're either making too much money to qualify for Medicaid or other reasons. Like, as I mentioned, there are some children that simply aren't in the SCHIP program just because they haven't been signed up for it. But there is that group of Americans that with pre-existing conditions and with chronic diseases, and as you know, there are 5 that consume 75% of the health care costs in America, where we're going to have to sit down with the governors and the legislatures and the health care providers and the patients and come up with a way of providing them access to health care in America. There's 21 states, I think, now that have placed restrictions on premiums and other things. There's a number of other states that are working on risk pools and providing the ability for, or not the ability, but facilitating a system where these people can be treated. The governor of Florida has a proposal called Cover Florida. But that's a major challenge that we face. And I think we can do it working with the governors and the legislatures, sitting down and having them fund, but also in the way that the federal government can also provide that care. So my answer to you is, I think that some of the statistics may be not accurate, but the issue of the uninsured and those with pre-existing conditions or chronic diseases is really particularly the pre-existing conditions is one that's the major challenge in health care in America today.